beds. This is a real problem for the most seriously mentally ill. I think we're down to about 11 per 100,000 people in this country, and that's the same number as in 1850. At the same time, these are most seriously mentally ill because there's no community health care, or there's not enough community health care, are going to emergency departments and are being boarded, sometimes for days at a time. What do we do? What can we do for the most seriously mentally ill?
So we've got a system that is at its breaking point in terms of capacity. I'm not 100% sure. We don't, as a research institution, I abide by the data. I'm not 100% sure that the data would say that inpatient beds is where we need to go.
Right.
I think if we had better outpatient care, better community mental health centers, et cetera, we can keep people well in the community. But they need more than that, right? The best evidence, for example, in first episode psychosis in individuals who are coming down with their first serious expression of schizophrenia and other psychotic disorders, that coordinated care, looking not just at stopping their psychosis, but also helping them with social issues, helping them with cognitive issues, giving them assistance with vocational help, that a combination of that care leads to the best outcomes. Mm-hmm. So coordinated specialty care, fortunately, is on the rise thanks to the research that we've taken out, thanks to our sister agency, the Substance Use and Mental Health Services Administration, promulgating coordinated specialty care as an evidence-based care practice for the centers that they fund. So it's on the rise, but it's really, really inadequate.
Right.
So if we could address the needs of those with a serious mental illness, we would maximize their potential. I would still assert that's not enough. We're not going to get enough people to full recovery, to full integration in the community until we come up with really transformative treatments.
Right.
And we're hard at work at that at the NIMH. But it's a good start. And if we could give everyone the treatments, if we could now give everyone the treatments that we know work best, mm-hmm. we would make a lot of people's lives a lot better.
So, this is sometimes referred to as the greatest health disparity that nobody is talking about, serious mental illness. So the lack of urgency many times to address what are just incredible disparities in access to not only mental health care, which is part of it, and physical health care. So people with serious mental illness die at least 10 years earlier than people who don't have these conditions, largely for health conditions that are treatable, but they don't get access to the screening, to the treatments. A lot of times providers don't think it's what they're complaining about is real. And because of this lack of integrated care, people don't get that physical health care either. On the mental health side, people can't get access to really good evidence-based care. People want to work, they can't get supported employment services. People want housing, supported housing, it's not there. The evidence-based care is not there on the mental health side. The Post reported of the woman who was discharged from the hospital in a gown, really, after an acute psychiatric episode. And there was outrage. But there should be outrage about the fact that every day, in every area that I know, people are discharged from acute circumstances with no follow-up care. Mm-hmm. You don't do that when someone has hip surgery. You don't do that when they have cardiac care. Why do we keep doing it when people have serious mental illness? Right. So that lack of coordination is really a tremendous problem for people with serious mental illness and for their families. And as I said, the financing is terrible. There's discriminatory policies that prevent payment for certain inpatient care. There's, as Dr. Gordon was saying, there's not enough financing for coordinated specialty care, which we know works. We know it works. We've seen it work. There's a lot of research showing that for young people, they go from, in New York, for example, 40% working to 80% working, 70% having rehospitalizations to 10%. These are huge changes. In any other condition, everybody would have access to that, but we don't. So when you think about it, people with mental illness, and particularly the most serious conditions, we always lag behind. We're always at the end of the line. We don't know why we're at the end of the line, because if you look at our numbers, we should be at the front of the line. If you look at that disparity that we're dying earlier at the highest readmission rates, we should be at the front of the line, and yet we're always at the back of the line. So, we say if you look at marriage equality, it was love is love. Well, we think care is care, and people with serious mental illness aren't getting much of it, physical or mental.